It actually hurts my heart to see chiropractors trying to make it with just the straight adjusting model because it's a volume in burnout model. And we have this amazing skill set as doctors.
Hey, everybody. Welcome to another exciting episode of the Trust Driven Podcast. I'm your host, as always, Dr. Josh Satterlee, and I'm joined today by the amazing, incredible Dr. Annie Armstrong. Annie, how are you?
Oh, fabulous. How are you, Josh? Thanks for having me.
Absolutely. Annie, I wanted to have you on because, through Trust Driven Care, we work with a lot of different clinics. And looking at just the number of patient visits you have and the different types of visits, it's clear that you are an incredibly busy, incredibly well-built chiropractic clinic that also does a little bit of physical rehab and training and whatnot. And so I wanted to have you on to kind of talk about your journey. It is pretty rare, as you know, to see a very successful chiropractic clinic. And even more rare than that is to see one that was built by a woman. So I think you have probably a great story to tell, and I'd love for you to share it on this episode.
Yeah. Well, thank you for having me aboard. And I guess when I became a chiropractor, the first thing that was different is that I really wanted to do things differently for my clients. I had come from a sports background and did my preceptor with a sports chiro, working with pro football. And I wanted to bring the very best therapies to everyday folks. And that was my motto. And that's always what I've strived to deliver to my practice. And that's really what sets it apart. So, really, I think that's what's most different about our story is just that insistence on building out a more programming for patients, really stepping out of the chiropractic box, which I think every now and then can be a little, I don't want to say short-sighted, but chiropractors are so gifted. We're trained so broadly and we have so many talents, but we only use the adjustment and our diagnostic criteria. When we're looking at treating patients, there's a lot more to it than just adjusting, in my opinion. And not all chiropractors agree with me on that.
That's right. The only other chiropractor on this podcast interview does agree with you, so we're fine. 100% of chiropractors agree.
Yeah, absolutely. And so it actually hurts my heart to see chiropractors trying to make it with just the straight adjusting model because it's a volume in burnout model. And we have this amazing skill set as doctors to deliver more services. At the very least, if you don't want to do soft tissue work, but I think that's imperative for a good program, is that you've got to bring in exercise therapy to your practice. And it has to be done right. I think what sets my practice apart is that we're looking for excellence across the board. And not that everyone isn't, but we're really picky about how we deliver our care.
Well, let's go back to the start of it. Like, how the hell did this thing even start? Did you start right out of school? Did you work for somebody else for a while? Where'd you start out?
Yeah, I started right out of school. Chiropractic was a second career for me.
Oh, really?
So, yeah, absolutely. I was in business first. Then I went into chiropractic. I was just looking to be into medicine and I didn't love blood and guts. So I thought, hey, and I loved chiropractors. I mean, I've been to a chiropractor my whole life, right? Yeah. So it was really a part of my healthcare. And so I chose chiropractic for, and also because I feel it's most powerful. We have such a huge amount of musculoskeletal injury in this country being poorly managed or not managed at all. It's just ridiculous. So sure. I thought I'd go dive into where I thought I could make the most difference for people. That's really why I started. My experience as an athlete helped program what I thought care should look like. I had worked with a chiropractor when I was a rower for University of Victoria, even though I'm too short to be a rower. But I was anyways. And he did a technique called active release technique, right? And I thought this is a game changer because we all have that story, right? Where we've had an injury forever that wasn't getting helped. And mine was the same. So he phenomenally helped me with soft tissue, active release technique. And I thought, okay, so that was always going to be part of my practice. And so I popped out of school and, hung my shingle. And
what was the first clinic? Like, now you have multiple rooms, you have a lot of square footage, you have a lot of people, but what was it to start?
Yeah, 750 square feet. I had one treatment room, no reception, no rehab space, Nothing. I had an office. Yeah, it was tiny, right?
Yeah,
And
I've seen this
I,
story before. Would you have linoleum floors, or were they like nicer than that?
I think it was actually carpet.
Fancy.
It was
Yeah.
so fancy. Yeah, but yeah, I dove in with that and started delivering my chiropractic active release
Hmm.
exercise rehab model. And it grew pretty quickly in popularity. I was
Yeah.
starting out when CrossFit was starting out,
Okay.
and
All right.
CrossFit knew about active release technique.
Yeah.
And so I got pretty hit by CrossFit early, which was great. It
Hmm.
was a great practice builder for me. But yeah, I mean, I wouldn't say it was a speedy start. Like every practice starting, you've got to do a lot of work.
What were some of like the big early on? So early in those days, going from zero to your first one or two employees, what were some of the things you realized? When did you get the confidence to hire? Because I think that's a sticky point for a lot of people is you get in that weird space of I can't grow until I, hand off some work, but I can't afford to hand off some work until I grow more. How did you handle that transition?
Just bullheadedness
Okay.
primarily. I believe in making fast decisions and then pushing them through,
Okay.
kind of. And obviously I fail sometimes, but for me, I was very aware of the fact that I couldn't grow without employees. So you have to take the leap of faith.
Was that your previous career in business? Did you kind of see that more clear than I would guess some of your peers that you graduated with or some other folks were? I don't know. Did you ever look at them and think like, this is not a hard decision? I don't understand why you're getting stuck here.
Oh, for sure. Yeah, and
Okay.
maybe that was it. I mean, I have been self-employed really my whole life. So
Okay.
I'm sort of used to managing that space a little bit
Mm,
more. And I'm sure that was quite helpful for me. But yeah, I mean, I hired a front desk person immediately.
okay.
It's important first hire was hiring my first athletic trainer.
Okay.
Yeah.
And take us through that. Like what were they hired for and when did you hire them? Was there like a patient visit marker like, hey, this 100 visits a week or something that you were like, I'm going to do it or
Not at all. No. I mean,
okay. Good.
no, I didn't have that clean of a marker.
You are the definition of an entrepreneur. Like, I feel like it. It's a good time.
I'm just going to go for it.
Yeah.
Yeah. I mean, well, I will point out that Washington State is unique in that they've worked with Premier Blue Cross, which is one of our biggest insurers. I think
Okay.
close to 60% of my patients are with Primera. And Primera has authorized the use of athletic trainers to be
Okay.
billed underneath a chiropractic license. So it's a really nice arrangement. But to
Mm,
be honest, all insurers except for a couple have that. If you look at the delegation of duties with insurance, who can do your exercise therapy in your practice, most have either an athletic trainer. Some don't have any particular requirement, but athletic
mm,
trainers are incredibly well trained people who are relatively, I don't want to say inexpensive, but they are relatively affordable.
affordable.
They're underpaid, really.
Yeah.
So I was able to secure an amazing athletic trainer and pay her well. And
Mm,
together we went wild with rehab.
yeah.
And because with her there, I was able to shorten my times with patients and have her fill
Mm,
in the rehab space. And then the model appeared really, and that was
yeah.
within, I don't know, the first probably 4-ish years of practice, I would say, or no, less than that, maybe 3 or I can't remember, somewhere around the third or fourth year,
Yeah.
I hired her. And then things grew like crazy, right? Because then I was able to streamline. And then I brought in my first associate as
Yeah.
well.
Yeah. I think, a lot of people, this is not just a chiropractic specific story, but like PTs think, oh, we need to grow, therefore we need to hire another PT. And chiros, I need to grow, so therefore I need to hire an associate chiropractor. And I think that if we look at other forms of healthcare like MDs, their second clinical provider is almost never another MD. It's a PA or a nurse
Exactly.
practitioner. And they'll even go like 2 or 3 of those before they hire another MD. And if I look at like an ATC skill set, the athletic trainer, what are they allowed to do in a day and what are you allowed to do in a day? If you kind of compare the two, there's really only 2 things that they can't do that you can, which is number one, they can't make the diagnosis, right?
Right.
You have to do that. And the number 2 thing is they can't do the adjustment or mobilization as we describe it, but they can, that's a grade 5, high velocity, low amplitude. They
Mhm.
could do a grade 4 and below, right? Like they're able to move joints and stretch people. And I mean, it's everything.
Absolutely. Their license is great. They could
Yeah.
even do some things that we can't. But my athletic trainers, obviously, I train them again. I like them actually fresh out of school, so I can train them in the head to toe way.
No bad habits.
They, yeah, yeah. I mean, I really do like to train them. So my athletic trainers perform exam intakes, the basics. They perform a bulk of my soft tissue therapies. I have them certified in, everything from cupping to ART, et cetera, et cetera. And they're experts in exercise already. And so they are an amazing match for me. So the doctor can then more work within, I almost call it soft tissue diagnostics. So if I have 15 minutes with a patient, I am assessing, I'm figuring out what needs more work. I may be touching a few key areas. I'm keeping treatment plan online. I'm keeping patient connection. I'm bridging the gap. And then the trainer flows in right behind me or in front of me in some cases. And it's this unique, unified treatment, and patient feels so cared for. Yeah,
I got a question about that.
yeah,
We're called trust-driven care, and we're really big about like building that trust with patients. And a very common place that can be fractured is where somebody comes in, they're referred to Dr. Annie, they see Dr. Annie, and then at some point you want to hand them off. And I feel like a lot of providers and a lot of offices completely drop the ball there. And it almost feels like a brush off to the patient. Like now you're second class and you're going to go with these people. When you said you do a great job of doing this, what things did you learn really matter? And what's a really good way to make it like they're climbing to the next step rather than getting pushed off because, like it's to a lower level provider? And I say that with quotation marks for those listening, like I'm quoting a lower level provider. A lot of times that person's probably better at exercise than you are these days, right? Like,
absolutely.
yeah.
And I don't have a problem telling a client that, but I introduce I introduce our model, of course, in the beginning, and I tell them that it's really just them getting extra care, extra service, extra help. And I really feed in the language and the findings from the athletic trainer, and we feed each other back and forth. So I'll say something along the line of like, Kelsey's working on getting your glute medius active again. She saw this in your gait. I'm going to work on this. She's going to work on that. And I make it very inclusive. And I simply, the other thing is I just simply don't offer longer treatments. Right. So I tell them they're going to get more care. They get bigger, fatter treatments. They get, a juicier visit per se. Right. So I make it sound very attractive. And I have, of course, very amazing athletic trainers. They're well skilled. They're well versed. Clients love them. And
So that works when it's Dr. Annie who sees the whole picture. Do you run into sometimes, like, have you hired associate chiros that are resistant to hand off the patient, that are like nervous, or that patients feel like they are being dumped on?
Well, I would say that would happen if you weren't careful with your training and your language and your hiring picks. If you just are going to farm someone out without that communication platform, then you're right. The patient's going to feel dumped on. They're going to feel like they're being handed off. But I think it's really important for clinic owners to realize when they're growing their practice that they can't be the star anymore, right? You can't be this.
Interesting point.
Yeah. I mean, I don't keep any patients myself. I treat 2 days a week, and every patient I see, I refer to my doctor team. It's a rare day I keep a patient on my platform because I want them to see my team, and I am not a star. So you have to your ego has to be gone. Like if you want to see the most patients and you want to be the best doctor and the very favorite person in the practice, you're not going to build your other providers.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
How do you handle that at the front desk? Because I would guess at this point in your career, there are boatload of people calling and saying, I was told to see Dr. Annie. And when they can't, or your schedule doesn't allow it, how have you learned to handle that?
Well, I mean, my front desk was well trained at really encouraging people to take the first provider that they can get in to see. Usually that works. People understand. They're like, and if Dr. Annie's, they always tell them, Dr. Annie is always available to check on your case, check in on you, look over your notes, look over your file. And if they really want to see me, then I'll see them first and refer them to one of my team. But my team is extremely well trained, and they're all a little bit different. And so I like to fit personality, number one, really, when I'm bringing in a new patient, like what personality is going to work best with this patient. And so I really sell my doctor team to them. And so it usually is no problem. Sometimes people are insistent, they want to see me. That's how I was referred. And that's no problem. I have space in my schedule for new patients,
Okay.
but I don't keep them.
Okay.
Yeah, as I said, rarely.
Fantastic.
So I think it's around really not having an ego in it, and just being able to let that piece go if you want to build your team.
Kudos to you, Annie, because every time I ask a question about how did you handle this, your response is your team has to be really well trained. It comes down to
Yeah.
good training. It comes down to, yeah. But one thing it sounds like you have mastered, even long before you found our software, is the role of communication in these things. So many times I think that's the part that gets forgotten in healthcare is communicating, like you're saying, a juicier visit is the reason to add in these additional providers. That everybody on my team can do this, or even if they're not being treated by you, that you communicating the fact that Dr. Annie will still take a look at your case or still review your notes.
Absolutely. And when I hand off a patient too, I tell them the same thing. I'm going to be checking in with you. I'm going to be watching
Right.
and reviewing your case. And trust-driven care has helped with this immensely. Now we have a communication platform where I can quickly reach out to a patient and communicate and follow up and check in. And same thing with all of my doctors. And that's it's really been great. So thank you.
I appreciate the kudos. It's just,
yeah.
I'll give you another 45 or 50 minutes to talk how much you love us. But in all seriousness, I just think that generally the communication piece is forgotten. I mean, I talk about this. If you look at the classes that are offered professionally, almost always it's ways to improve your treatments, right?
Yes.
And maybe there's some to improve your diagnosis. But the communication side just gets ignored. And I mean, like you do ART or muscle work, and I think that has the power to explode your clinic if you communicate why it's so important to do that, rather than just jam your thumb into their glue meat or whatever.
Yeah, absolutely. Yeah. I couldn't agree more. And when I hire, just to reflect on that, when I hire a new associate or a new clinician for my office, I hire on personality. I hire on how they communicate with patients. I can train their hands, but I can't train their personality, because that's the key piece of it for me. And, everyone in my office is told a story of their recovery, right? First their repair, then their restore, we're restoring movement and function, and then we're rebuilding them. We're getting their body ready for load. We're loading them, and we're exiting them. And so we communicate the story of their care with us and all the pieces to it, right? This is where athletic trainers are going to come in. This is the et cetera, et cetera, et cetera. So they're clear, their expectations are set. Yeah. So communication is key. Couldn't agree more.
Yeah. I wonder if your previous experiences, you just didn't realize how great you were at that, because the story of how you grew so quickly too, and you were able to bring on people, and it sounds almost like there wasn't any speed bumps, and I know there are always speed bumps.
Many speed bumps.
Yeah, but it's amazing how much extra rope a client will give you if you just communicate with them, like, even when you drop the ball or even when you hurt them or something, and we don't want to do those things, but they just happen, and so making sure you've communicated that it's.
Absolutely. I mean, we're manual therapists, right? I mean, we're going to make someone too sore, too stiff. There's going to be times when we do too much of something, right? In trying to do our best, especially with active release, right? You think you're doing a great job, and someone is so sore for 3 days they never want to see you again. But if you've communicated with it and you've used your trust-driven care platform to say, hey, guess what? You're going to be a little sore in this and this because we did this, right? And just know it and communicate with me next time, and then we'll adjust.
Can we dive into, I'm sure some people are listening and thinking, it sounds like everything was puppies and rainbows for Annie. There was just smooth sailing, and, she never struggled to make payroll, never had an upset employee, never had an upset client. And it's obvious with what you just said that that's happened. But looking back on your journey to growing, and you've, by all measures, have an incredibly successful clinic. Looking back, what were two big mistakes you made you wish you could have done it differently?
Well, again, it's been in personnel. It's been the number one mistake I made was in billing.
Okay.
And it was a lot of people's mistake, right? We try to do it ourselves. We try to have a receptionist do our billing. And, it's gotten even worse now in my state. The billing is it's a full-time job for now. I have 3 people on it, right?
It's like the insurance companies are inventing puzzles for you to figure out,
Let's figure this one out and see if we can get them not paid this way. And so, my biggest mistake was having my receptionist do my billing and not because I was just a doc and and an ATC then. I didn't take the time to train her
Okay.
properly. So that cost me a good chunk of change.
Was that just that she didn't have the knowledge to do it? Was it the type of person she was? Like, what was it about that? Overloaded?
Both. No,
Okay.
she was a terrible receptionist anyways.
Oh, good. She made it even worse
Um,
to look.
yeah, but I mean, back then I was so buried. I was seeing patients, myself, on like 100 plus patients a
Yeah.
week, doing active release rehab, all this stuff, so busy, and not spending the time to run my practice. So that would be the number two mistake, right? Is not taking the time to run your practice. You know,
When did
everybody
you
knows this.
when
But
did you get some clarity in your head and say like, nah, this has to stop or things need to change? Was there a moment or was there a day where it just absolutely went mushroom cloud in there?
It built up for a long time. I worked way too hard, so I ran a very big practice in 15-minute increments in between patients. And so I got sick.
Oh, okay.
Yeah,
Do you mind
I
going
got
into
really
that? Yeah,
ill.
we don't have to, but
No,
yeah,
it's okay. I had some issues with my health, and I'm a super healthy person, but I
yeah,
was working, my stress level was so high,
yeah.
and I was working so many hours. I was just absolutely frying myself.
Yeah. I want you to share because I don't think that it's rare for that to happen.
No,
I think
it's
that
not rare at
business
all.
owners and people who have advanced degrees have always solved the problem by let me do more. I will take on more. I'll take on more
Yeah.
education. I'll take on more student debt. I'll do this to achieve this goal. And then you get into practice and you think, I want to achieve these goals. I will sacrifice myself. And I've had dozens of friends that, you see them at a conference or something. And I want to ask, like, what happened? Like, what? I don't know how to say it, but,
Yeah.
they look 4 years older after 1 year.
Yeah. Yeah. I
So,
mean, I think we all get to that, right? And
yeah.
I was at that stage hiring coach after coach, trying to find, I knew I had an issue, right?
Okay.
I had, because I was still exhausted. I was just working way too much. So I knew I had an issue to solve, whether it was operations or streamlining or better training or whatever it was. But
Mhm.
really, the answer came in the fact that I had to stop putting myself in to fix the problems, right? It
Yeah.
was always like, oh, it's a slow day. I'll go into work because I know I'll just bring people in because I do. I go in and fill the day, no problem. But I'm like,
Swooping in like a superhero and saving the day,
yeah, just
right?
going in, okay, we're slow. I'll go in and fill the day. And I've got, associates sitting on their thumbs and I'm working my booty off, right? It's like, no, this is not the right picture. And that was happening probably, I don't know how many years I was in practice, probably maybe around 10 years in practice, right? And I was just realizing I was like burning at all ends and they necessarily weren't, and it wasn't their fault, right? So I had to resist stepping in to save the day.
Mm.
And instead, I had to look at my operations, my procedures, my training, my coaching, my leadership, and I just had to stop. So it was like I had to sit on my hands, and that's what I did. And I took a day off during the week.
Yeah. You don't seem like the kind of person that sits on your hands. So,
I'm not super good at it,
I
but
mean,
to
were you
run a
going out and doing stuff? Were you golfing or I mean, we talked about skiing. Like, were you using that day to go be active? Were you handling behind the scenes stuff? Like, what?
yeah, in the beginning, really was just peeling back that admin day, just a full day to look after the practice. It's only recently that I peel off a day to go skiing.
Okay.
But I pulled off a day to do admin, and now I've pulled off 3 days, and that's been a really great change. And it was just like, I won't go in and save the day anymore. I'll look at what I'm doing wrong operationally. I do believe in practice. If there's something failing, it's always on my shoulders, right? It's up to me and my training and my platform and my operations and my procedures. Something's broken, right? You have to look at
Yeah.
yourself first.
But
Always.
I think too, there's some sense like last year, my son had this big project he had to do. And it was clear we hadn't taught him how to tackle a project like that.
Mhm.
But you realize I can't do the project for him because then he's not learning. Then he's not achieving his own. He's not gonna feel the reward of, hey, after you put all this stuff together and you did this, like you earned this. But we definitely had to provide better support. So how do you balance that of like, I could be the superhero, but I'm gonna let them suffer. I'm gonna let them stumble, and I'm gonna let them have the success. Like, how have you learned to handle that for other business owners listening?
Yeah, that's a great question. I actually I don't really want to let them suffer. I don't think that's the right terminology. I had to become a better leader. So I had to step away from just doing the tasks for them, just like raising a kid, doing the tasks for them is not the answer, right? As you just
Right.
mentioned. But for me, I tried to make my meetings more valuable and more consistent for one. So every doctor has a personalized every clinician has a one-on-one every month, which isn't a lot, but it's just a time for them to come to me. I really look for criticism on what I'm doing from them, and I give them, feedback. We talk through issues. It's a really personal time for them to
Yeah.
express to me how things are going for them. I also try to encourage them without just looking at, the dry numbers, right? Which is like, okay, I want you to up this and up that and up this and up that. That just feels like, oh, they're just, it makes them feel tired, Instead we try to look at of other ways that just encouraging the business to grow. Let's see. I've lost track of your question.
Yeah, I was just saying, like, how do you balance when I said suffer, let them suffer, like, I think in some learning you need to feel the pain of why you need to change, right? Like,
Yeah, I think so
understand the
too.
problem, let them sit in it, not just pull them, like rescue them and pull them out, like,
Yeah.
so
I
they have
think
some reference point of how bad it could be.
Yeah, I guess I haven't put them there at all.
Okay.
I'm very protective of my staff and my team. I would say I care for my doctors greatly. I pay them well, I train them well,
Yeah.
and I'm their ear and I'm their support. And so I think of it more of that way. I try to help them with more positive coaching, so it's not really the sandwich model, but I try to be very radically open in my communication
Mhm.
with them, both bad and good, and I want the
Yeah.
same from them to me. So I want, because we're a growing team, we're a little company, we're all working hard, doing our best. And we need to be honest with each other, and it needs to be a safe space to do that.
Mhm.
And so that's been really helpful. And then also just digging down a bit more on some of the basics, right? Some of the basic treatment plans, why are people, as you and I have talked about, why are people dropping at certain stages? How do we need to relanguage something? What do I need to create to help you make sure your treatment plan is successful? Is it a
Yeah.
handout? Is it training? Where are we falling? We're like really trying to identify
Mhm.
where that is. And then, really for me, learning how to really, I will use the word sell, but it's really not a sell, but really promoting my doctors to my patients who have been attached to
Mhm.
me for a long time. Promoting that group has been
Yeah.
really important for me.
Okay. When you have those one-on-ones with your doctors, you said you have that every month, every quarter,
Yeah.
every
We
month.
do a one-on-one. We do a one-on-one every month, and then we do obviously all staff meetings, and then just group clinician meetings as well.
Yeah. Has anything come up in those meetings that you were really surprised at, of like the thing in the way of growth? Oftentimes we think like, oh, if you just get more reactivations, or get more rebookings, it'll solve this problem. But I certainly have had the experience as an employer of, like, they admit something, much like a patient talking about their scary symptoms, right? And they're like, hey, it's
Mhm.
actually this. And I'm nervous to tell you, but I remember a patient was talking about low back pain, and he admitted that 3 nights before, because we always ask about like urinary incontinence and things like that, those red flags. But he said, it's funny, I didn't want to tell you, but I peed my bed like a lot. I didn't even realize it, blah, blah, blah. And you're like, okay, like all we need is an MRI now. Like, like there's no judgment. But that is a different symptom, and I want to get you the care you need. And so sometimes I've been surprised by what the limiter was in a employee or team member feeling like they can get to that next level. Sometimes it's emotional support. Sometimes it's, I didn't want you to be angry when I said this, or, like that fear. But have you heard anything in those meetings that was surprising or maybe even embarrassing for you as an owner? Like, oh my God, I can't believe I haven't addressed this before.
I would say not really in the way you're speaking of. I think probably what I've been most surprised about, because this generation of workers, my docs are young,
Mm-hmm.
they're are all in their 30s, and their value system is actually much wiser than ours, right? They really value that work-life balance. So grinding away on, patient visits, lows, reactivation, numbers, work harder, get more, like you and I are probably raised to do, it doesn't
Mm-hmm.
resonate with them, right? And I think one of
Interesting.
the interesting things that came up for me on one-on-ones was actually during COVID. It came in after COVID, but
Yeah.
they were reflecting on COVID fondly, the first little bit of COVID when we were all like in shutdown and all this sort of stuff. But what we did when we couldn't see patients is we trained, right? So everyone taught. So we each brought our specialty forward and we trained each other.
Oh, okay.
Yes,
That's
we
kind of a
trained in
cool
the clinic.
solution. Yeah.
Yeah. So, because, I kept everybody employed, obviously. And so someone taught, functional patterning and someone else taught this or someone else taught that. And we did all this unique rehab training. We did, lymphatic drainage, diaphragmatic release. We dove into all
Wow.
sorts of stuff that not all of us knew. And we loved it. And everyone said, hey, I want to bring that back, which did surprise me, And so now we do more pop-up trainings consistently in the clinic because we really enjoy it. We'll do like, hey, let's do like one of my docs is like an amazing Olympic weightlifter. So we did like, let's do Olympic weightlifting prep one day. Next week we're doing a gait assessment, which sounds boring, but it isn't from the guy who does it in my clinic. He's brilliant at it, so good at it. It's like, okay, let's make sure everyone's up on gait assessment. And so we really all are learning from each other. So that was a kind of a surprise and something that I've brought forward into the clinic after COVID in case these training breaks. Yeah.
Yeah. What is your like staff meeting and training schedule? So we have one-on-ones once a month with your docs. Is that also with your admin staff and your ATCs?
My ATCs, I do separately. I don't do it every month. I take them for lunch. Probably every quarter we do a lunch, and not as consistent as with the docs. So I'll throw in the all clinician lunches when I really think I've got enough to talk to them about. It's just time to gather and share, and I want the athletic trainers and the docs to share information and talk. More like once a quarter with those. All staff, maybe twice a year, because unless I have really relevant information I need to address, because I hate boring meetings. I don't want to bore my staff with meetings.
Yeah.
I have a very open door policy. So if there's something they really need, they all know they can walk in and talk to me anyway. Yeah. So, this morning I did a 30-minute billing meeting because there's a bunch of stuff that's come out on some stuff, right? Just these little meetings that are more directive is what I like to do. But yeah, so it's more a pattern of monthly for the docs, quarterly for all clinicians, maybe twice a year for all staff.
And then do you have a regular, just general weekly all hands meeting that's like tasks or updates and things like that as well?
We have twice daily clinician meetings because we're working as a group, right? So two of us are treating a client. We have to be up to date. So it's just a quick huddle. We have about 10, 15 minutes in the morning before we start patient care. So we're going to look through, identify patients that are struggling, maybe some new creative ways to get around it. People will share, we'll think, kind of get programmed for what we're going to do so we flow well. And then we'll do it again at lunch, just before we start with our clients again. We'll just do a quick huddle because we need to be smooth for the model to work. It needs to feel like everybody knows on task. If someone walks in like, oh, what are we doing today? I'm not really sure. Like, no, then you're going to feel farmed out. Instead, we're targeted, right? We know what we're doing. We have a plan. Everyone's on board. We're changing plans. Maybe we're changing providers. Maybe whatever we do, we've communicated beforehand. So that's really important for us.
Annie, this has been an enlightening experience about you just casually talk about how well your staff is trained, and I think it really shows in your patient visits and your number of patients and just how many lives you changed. Looking back at what you built, so how long has the practice been open, by the way?
This is going to be year 19.
Congratulations.
Thank you.
What were some big milestones, like first time you passed $100,000? Were you like, woo, or $500,000? Like, were there milestones that you felt like, or was it staff members? Hey, I finally have enough staff that I could take a week off and visits don't have to go down.
Yeah, it's a great question. I'm bad at celebrating milestones, like many business owners are. We just kind of cruise through and go, oh, we got there. Oh, we got there. Oh, we got there. We just keep rolling, right? But I would say,
so if you achieve this and you're like, yeah, but the next thing is way more exciting. And then you achieve that. And it's like, well, it's false peaks all the time.
Yeah, I'm celebrating the milestone of paying off my student loan today. So that's
today?
A big one. Well, actually,
really?
It was last week, but
congratulations. That's awesome.
Thank you. That was a good one. Yeah. But I'd say you're hitting the $1 million mark. I can't remember when that came around. That was a big milestone just to kind of see that. Like, oh, okay. I got to practice that big. And taking my Mondays off was a big milestone. I don't know when I started doing that. I think when I brought my fourth associate in, Dr. James Bradley is great. Such a great team I have. And And, he came in, we trained him, he caught fire. And then I'm like, you know what? I'm going to do it. I'm going to take this Monday off. So personally, having a Monday that I actually don't do admin work and I just either mountain bike or ski or hang out with my
Like
family or
off.
whatever, off. Yeah, that's been a big one. I had to fight really, I didn't know what to do with myself, to be honest, because Monday is a busy day in practice. I was like,
Yeah.
what's going on here? So that took a while, but now I'm enjoying it more.
I
So
know
it's kind of a good reward.
there's a gym, IRSA, it's like this big fitness and gym association, and they say that 42% of all of a gym's clients will show up on Monday.
Oh, yeah.
And then the rest of the week, all is left to chance, but almost half your people will be in on Monday.
Mondays are always busy, always
Yeah.
busy. Yeah.
That's awesome.
So that was a personal milestone, little reward for myself. So
Great.
yeah.
Okay. Well, I wanted to have you on because I think your clinic is amazing. You're amazing, and I think it's a great picture of starting in 750 square feet, and then next thing you know, you're taking Mondays off to ski, and you have a great team, and
Yeah.
paying off student loans. Like
Yeah.
win-win-win.
Yeah. It's never easy, but I love my practice and I'm not burnt out. So I think that certainly if there's any docs listening to this show and they need help with building a rehab platform, don't hesitate to reach out because I think it really adds to your practice and it can alleviate some of the work and just make it a better experience for patients. So
Yeah, one thing that's always struck me about you, Annie, every conversation I've ever had with you, you are very interested, you're very engaged, you're very present. And so a lot of people put it out there like, oh, contact me. But I will say that anybody listening, if you decide to crack the seal on that can, Annie's going to be interested in what you're talking about.
Yeah, absolutely. I mean, I think we need to share with each other as chiropractors. And, I hate it when I see chiropractors go out of business. 3 just around me have gone out of business lately. And I know their style of practice. And I know one of the reasons they went out of business is they're collecting 25 or 30 bucks a patient. Like, how do you make it on that? I don't know. Why not build more, right? Why not do more?
You don't have good data to say you can't make it on that. You will go out of business.
You got to really have a volume practice, and if you're a great doc and you don't want to spend 20 seconds with your patient or 3 minutes or whatever it is, like, yeah. So anyway, but please, yeah, absolutely. Love to share anything that could be helpful to anybody.
Awesome. Well, thank you so much for the time today, Annie. And for those wondering, Dr. Annie's clinic is called
headtotoclinic.com is the website.
Okay.
Head to Toe Spine @headtotosspine is our Instagram handle.
I totally had it backwards. I'm glad you explained.
I got lots of different names just to keep people confused.
Yeah. So check them out. And they're up in the Seattle area if you're ever looking for a place to go and learn from. And like I said, Dr. Annie's very engaged and very present in every conversation we've ever had, which is a great attribute in today's distracted society. So thank you so much.
Yeah. Pleasure. Yeah. Thanks for having me.
Absolutely. Well, this has been a little slice of heaven. And in honor of Dr. Annie and everybody out there building their practice and fighting the good fight, this is Dr. Josh Satterlee saying, when we build trust, we improve lives. Thanks, Annie.
Thank you. Have a great day.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.